mild blue, and it's my pleasure to welcome Tomáš Kouřim.
Hello.
Hi, Tomáš.
Hello. So, would you like to be on a beach? Well, who wouldn't, right? But you can't, because you are all patients. We are all patients, and if we are not yet, we will be pretty soon. And if a patient is on a beach, then there is a distance between the patient and the doctor, and that's a problem from the medical point of view. Therefore, the patient has to go to see the doctor or even go and stay in a hospital. And that's a problem from the financial point of view, because that's expensive. One night in a hospital is over $2,500. And you know, $2,500, that's quite a nice fancy hotel. Altogether, the total healthcare expenses in the US are this incredible number every year. I believe this number is called $1 trillion, so $4 trillion every year are the spendings on healthcare. And you know, that puts enormous pressures on the healthcare systems to be effective, to save some costs. One of the most promising areas is remote healthcare. And we have seen it today that it's really a thing. But remote healthcare is also really complicated. And to create an application that solves it all, that's almost impossible. On the other hand, what works really, really good are small little applications that only focus on one particular problem and solve it. That exactly is HealthWarden. HealthWarden is a post-treatment remote patient monitoring app that is given to a patient in a similar way as medication is given to the patient. It guides the patient after treatment with the specific problems. It has protocols that help to achieve the best clinical results. It allows thus clinicians to discharge patients earlier from hospital. It reduces the number of readmissions and altogether helps provide the perfect care for the patient. Of course, we are an AI-based company, and this is an app, so it has all the buzzwords you have been waiting to hear. But actually, the application and the idea behind it is quite simple. I would like to stress out 3 of those. The scaling. We have some procedures, some treatments, and some protocols built in, but it's super easy, thanks to the modularity, to add new ones. We also know that even though they treat the same disease, each doctor does it in a little bit different way, and therefore all the protocols are fully customizable. And last but not least, HealthWarden remembers all those actions the doctor did, meaning that the doctor never ever has to do the same thing twice. Now, to come back to what I've been talking about, money. I have one example, transcatheter aortic valve implementation. It's a new and quite interesting procedure when they put a thing into your groin and implement new valve into your heart. And what's interesting about that is that some patients go home immediately after the procedure, while some spend a week in a hospital. And if you remember, that's exactly where HealthWarden can help. It can significantly lower the number of nights spent in a hospital. And if you remember the cost of one hospital night and multiply this magic number with all those constants, you get $2.8 billion that can be saved on direct costs connected with TAVI only. And we are talking about TAVI not with the rehospitalizations. And TAVI is just one out of many procedures that HealthWarden can help with. Now, HealthWarden is not some virtual concept. It's a working application. If you are a patient of ICAM, you can log in, and you can try it out. If you are not, you can ask me nicely. I can give you test credentials, so you can try it out and see. Of course, it has all the necessary integrations. It has the scalability. It's secure. It's safe. It's compliant, and so on and so on and so on and so on. Now is the time for me to say thank you for the team for being super creative, super fast, super skilled, and just awesome. And now is the time to say thank you to you all for your attention, and I'll be eager to answer all your questions.
Thank you, Tomáš, for this impressive presentation pitch that really makes me want to spend the rest of the week somewhere at the seaside. But of course, hospital is the best, even beats the sea. Isn't that true?
Of course. It's 2,500 per night. That's about you. It's premium services.